Hello, Mr. Bill 1911 here, and as always, if you have any history of any cardiac, respiratory, circulatory, or orthopedic condition, or are over age 30, please consult a physician before starting any exercise program. Today's topic is, do rotator cuff tears require surgery? Maybe. And this is something where I would particularly urge you to discuss it with an orthopedic surgeon already treating you, or to see one if you suspect this is the kind of injury you have, as well as be seeing a physical therapist who would be part of that treatment triad of patient, doctor, and therapist. Now, first of all, what would be some things that might argue in favor of pursuing the surgical approach? That might be things like a injury in a single tendon, a relatively simple tear where it was previously healthy, and if you're younger, because then you're more likely to have good healing and better ability for the tendon attachment back to the bone to be successful. Also, if you have issues with especially nighttime pain, if it interferes with activities you have to do, like getting washed, dressed, or job tasks, those might be factors arguing in favor of surgical repair. In more severe cases, where you would have multiple tears, degeneration in multiple locations in the shoulder joint, that would be something where more involved surgery would be required. Again, you'd have to discuss this with your orthopedic surgeon, things like a reverse shoulder replacement, where the deltoid muscles then become the primary stabilizers and movers, and as long as those are intact, that's an option. There's also something called superior capsular reconstruction, where they use tendon grafts from either the Achilles or the lateral thigh to repair that, but that can have a high failure rate, and again, I would urge you to discuss that with your physician. Between surgical options and conservative non-surgical treatment, there's also platelet-rich plasma, which you can look that up if you care to do so. Where that might be most applicable might be for some partial thickness tears, and there's a National Institute of Health study cited on that, and they found they could have good results with that. The recovery curve might be shorter, but there is still a recovery curve to go through. It's not like you get this done and a couple days later you're back to usual. It's not as prolonged, but it is a period of several months or more, till you could start gradually resuming more activities. Non-surgical things would be like over-the-counter pain medications like NSAIDs, Tylenol, hot and cold applications, topical NSAIDs like Voltaren. The thing you have to be aware of, there can be risk as far as renal function, cardiac risk, and GI bleed risk with longer-term higher dose use of NSAIDs. Again, I would urge you to discuss that with your physician. The other portion of that would be guided exercise with flexibility and strengthening work from a physical therapist. And the particulars would vary from one individual to another, because one rotator cuff tear is not necessarily the same as what somebody else has. So the exercises one person might require might be different from somebody else. And you do have to give that a period of time to find out, but if you can get adequate pain relief in a period of, say, several months, and improve your range of motion to where it's functional and doesn't impair most of the activities. For my example, I retore my left supraspinatus. I can easily extend overhead. I can abduct to the side with very rare discomfort. One of the things you might have to accept, especially if you have, as I do in my case, a complete full thickness tear with retraction, which means that supraspinatus tendon is simply not attached anymore. Even if you get the pain relief, which I got, you will need to accept that you are not going to get back to 100% of what you were before. If you try to do so, you might end up with worse injury, and eventually end up with surgery, which then you're kind of missing the boat on avoiding surgery. And that is your fit tips for today. Thank you.